Hello everyone, I'm Son婭京from Peking University. Welcome to the second Pbl medical talk show. Today, I will introduce a mental illness, anorexia nervosa. First, let's listen to the description of a patient who was diagnosed with this disorder.
At the age of 12, I experienced an eating disorder that made me never look at food the same way. I was always a nervous child, but I had a heavy breakdown when I couldn't keep up with all the changes thrown my way. I started middle school and had trouble making new friends. That same year, my father also left to start a new career in another country. Everything spiraled out of control, and soon my body began to reject food the way it rejected these harsh realities.
Thanks for New English Magazine providing materials. After listening to this description, how about the specific medical conditions of patients with anorexia nervosa? Let's take a look at the case. This is a female student. She was 17 years old. Her weight gradually decreased in recently 3 years. She ate less, almost no staple food and meat. She took a variety of weight loss drugs. About past history, no history of drug allergy. She was overweight since childhood. She had been amenorrhea since she was 16. Her family history is negative. Let's see her basic vital signs. Her temperature, heart rate, blood pressure, and breath rate are shown on this figure. Her height was 1.62 meter, weight 14 kilogram, BMI 15.24. Her physical examination indicated her body weight loss, dry hair, inapparent secondary sexual characteristics. We are curious about the following related question. What's the mental state of this patient? What's the possible signs of this disorder? What's the etiology of this disease? What are the clinical manifestations of this disease? How to treat this disease? As a psychiatrist, we are certainly concerned about patients' mental state. First, patients may feel dread of fatness. She may have body image distortion, which makes her think that she is fatter in the mirror than she should be. We often see her checking her figure in front of the mirror, worrying about whether her weight is gaining again. Physical signs indicate us that the patient with anorexia nervosa has low weight. BMI is under 17.5. She has lanugo hair on body, loose hair on height. We found that she often has cold hands and feet. Once her skin breaks, it doesn't heal well. The instrument show that she has bradycardia and decreased blood pressure. After understanding the clinical manifestations of anorexia nervosa, let's take a look at the etiology of this disease. Anorexia nervosa occurs in 0.5 to 3.7 of the general population. Female to male ratio is 9 to 1. Adolescence to young adulthood is the predominant age. Mean age of onset is 17 years old. The patient may die of starvation or suicide. The cause of anorexia nervosa are as follows. We will mainly talk about genetic factors, psychological factors, and biological factors. This is now a substantial body of evidence supporting a role for genetic factors in the development of anorexia nervosa. Systematic genome-wide scans based on families with two or more individuals with an anorexia nervosa revealed initial linkage regions on chromosomes 1, 3, and 5. Early attachment experience interact with genetic factors to modulate personality features, childhood psychosocial development, and HPA-axis development. Once initiated, underlying susceptibility factors and the impact of starvation upon psychological and biological systems maintains the vicious cycles of anorexia nervosa. The MRI data of anorexia nervosa were also different from those of normal controls. Martin recruited two groups. Group analysis revealed significant reduced green matter volume throughout the brain in anorexia nervosa patients. More biological factors are still under discussion. In the DSM-5, diagnostic criteria for anorexia nervosa are as follows. Restriction of energy intake, intensifier of gaining weight, specific psychopathology, such as body image distortion. Next, let's talk about the treatment of anorexia nervosa. We should provide a balanced diet aimed at gaining 0.5 to 1 kilogram weight per week. If her weight loss is severe, electrolyte levels should be strictly monitored. After the acute freeze, family therapy and cognitive behavioral therapy are encouraged. Drug treatment has met with limited success. Finally, let's discuss the prognosis of anorexia nervosa. The condition runs a fluctuating course. If the patient has the following points, the prognosis is not good. A long initial illness, severe weight loss, older age at onset, binging and purging, personality difficulties, and difficulties in relationships. Thank you very much for this competition held by Elsevier. Clinical K student and complete anatomy helped us a lot. Here is a brief introduction of how to use Clinical K and student. Log into CKS to register and you can use it. You can see various books, including the latest medical materials. Ferris Clinical Advisor, Goldman Silman Medicine. There are also books related to USMO, which may help you understand comprehensive medical knowledge. Thank you to my tutors, Liu Jing and Li Xueyi. Many thanks to Elsevier. Hope the competition will be a success.